None of you have cleaned me today. None of you have fed me. And none of you are helping me to commode. So you're disconnecting me from my payment.
Yeah.
Okay. In the middle of a crisis. In the middle of a crisis. No, it's all right.
Lola was thrown out of hospital in the middle of the night in freezing temperatures while she was seriously ill.
This is my lobster tail. Looking forward to enjoy.
Irene went into hospital for dehydration. She never came home.
You okay?
You right?
I'm so sorry.
Her husband says the system failed her. Aaron says he's viewed with suspicion when he seeks care, and going to hospital has left him traumatized.
I get looked at as an addict because I ask for morphine.
These are the experiences of people with sickle cell. Their concerns ignored, their pain dismissed, and their condition misunderstood. For sickle cell patients like Lola, irregular shaped red blood cells can block blood flow around the body, causing extreme pain. This is called a crisis, and without urgent care, it can be fatal.
During a sickle cell crisis, it feels like, for me, it feels like shards of glass going through my veins.
And in terms of the, what have you taken?
And the pain? This is what it sounds like.
It's a very deep, stabbing pain.
Aaron comes to this specialist sickle cell unit for red blood exchanges, a procedure that removes his sickled red blood cells and replaces them with healthy donor blood.
Honestly, it's mentally draining. Mentally, physically, emotionally draining. Waking up every day, wondering if I'm going to be okay.
But coming here is only part of Aaron's experience. His care during a crisis in an emergency ward is totally different.
It's horrible. It's absolutely horrible. I get looked at as an addict because I ask for morphine. The nurses look at me as an addict. They leave me in the hallway for hours on end, no care, nothing. It's absolutely horrible. I have PTSD of going into hospitals. I can't stand it. I'd rather suffer at home than go to hospital.
And Lola knows that experience only too well. In 2022, Lola was admitted to University College London Hospital during a chest crisis. Over 2 days, her condition got worse, not better.
None of you have cleaned me today. None of you have fed me. And none of you are helping me to commode. So you're disconnecting me from my payment.
Yeah.
Okay.
I was deteriorating really fast. I started growing blisters all around my face.
Why do you think it's happening? Why do you think the NHS is failing sickle cell patients?
I believe it's because of systemic racism. I think some medical workers know what they're doing, but they don't care to change it.
University College London Hospital says they have declined Lola for further treatment due to her behaviour, which they said was not in line with their values.
Sickle cell is the most common inherited blood disorder in the United Kingdom, and yet many people have never heard of it. Around 18,500 people live with the condition, and some 300 babies are born with sickle cell disease every year, making it the fastest growing inherited blood disorder in the UK. Sickle cell hospital admissions continue to rise. They went up by 42% between 2013 and 2022, from over 30,000 to more than 42,000 a year. And the median age of death for sickle cell is 47, compared to 84 in the general population. That's a gap of nearly 40 years in life expectancy.
Irene was 47 when she died, but it wasn't sickle cell that killed her. She'd lived with the condition her entire life and managed it well at home, where she felt safer than in hospital. Last August, she admitted herself to hospital for dehydration. It wasn't even a sickle cell crisis. We spoke to her husband, Dominic.
one of the things that Irene told me is that, sweetie, they're not listening to me. Everything I ask is pushed back or totally ignored because they're looking at me as though I'm a difficult patient. And that's what's happened. That's what's triggered my crisis.
Irene had warned staff her IV fluids needed to be warmed up. For sickle cell patients, cold fluids going directly into the veins can trigger a crisis. But she was ignored. Frimley Health NHS Foundation Trust said it was sorry for any shortcomings in Irene's care and had fully accepted the coroner's findings.
And it just breaks your heart, really, because, yes, Irene went into hospital because she was unwell, but I never, her family, her sister, my children, our children, never expected her to go into hospital and get worse to the extent that, she passes away. That's just not what anyone would have expected.
The coroner had ruled Irene's death was preventable. Gross failures in her care which amounted to neglect.
You have every right to be angry. You've lost your wife, your children have lost their mother, and the coroner said this was a completely preventable death. You okay? You all right? I'm so sorry.
Yet Dominic blames himself.
You try and put a brave face on, not least for the kids' sake, but also, you try for it not to break you down. But it eats away at you. Internally, it really eats away at you. You blame yourself first.
Why do you blame yourself?
If it was avoidable, was there any more noise that I could have made for them to actually listen?
The coroner's findings did not lead to a prevention of future deaths report. This would have meant the lesson needed to be learned across the whole system, not just this hospital.
It's not the first time a patient with sickle cell has gone into hospital and become worse, and there's a very clear trend, but we're not connecting them.
Nurse consultant Keisha Osman-Joseph has devoted her life to care for sickle cell patients. She showed us what treatments are offered at this specialist unit at London's Central Middlesex Hospital.
Would you just explain what's happening right now?
So at the moment we've got a patient, this is Albert, he's having his first red cell exchange. So the red cell exchange is a procedure that exchanges the patient's defective sickle red blood cells and replaces them with donated hemoglobin A cells.
Hugely important, life-extending.
Life-extending treatment.
But she says there's an urgent need for more funding.
Most people who are working in the sickle cell space will say, this service and these patients have been underserved for quite a while. They've been, services have been underfunded for quite a long time as well. And we're grateful for the injection of funding at the moment, but more is needed. More funding is actually needed as the numbers begin to grow.
Patient advocate Laurel has lived with sickle cell for 62 years. She says the problem isn't just staff training.
I can't even say the extra training because I really think training is one thing, but I think you can train anybody to really do a job. But that empathy and that compassion and that care is something that you can't train somebody to do or have. When I wake up in the morning, nobody sees me. Nobody sees what I feel. Nobody sees what struggle I go through because I look like this. But if I was to have a crisis right now, you would know, because that pain is so severe.
A centre like this, run by people who specialise in sickle cell, is not what most patients walk into when they're in crisis. Instead, they have to turn to general accident and emergency. And that's where patients tell us things go wrong. NHS England says it recognises the serious concerns raised. It told us it is unacceptable for patients to be disbelieved, stigmatised or left facing delays. We've strengthened our sickle cell standards to ensure care is equal across the country and improved staff training to reduce stigma and improve understanding of acute pain.
I like to crawl before I can walk. So before I consider other means of treatment, I would like to know the basic and bare minimum care is well.
For these patients, care comes down to one thing, and that's whether or not the person standing in front of them believes they are in pain. And until this failing is addressed, they say, their sickle cell care will continue to be a lottery.